Hello everybody, it's Les. I want to continue today's video. This is, as I told you, last video is going to be a series on a lot of the risks that we face in retirement. This is all part of my new fancy RICP designation about retirement income. And this is one of the more significant risks that we'll encounter in retirement. And here at YellowWood, as a team, we talk about the risk of long-term care and the expenses and who's going to administer that care and that kind of thing. But I just want to reiterate it once again. So apologies if you've heard this story before, but I think we need to focus on it once again as we go down the list of different risks in retirement. So long-term care risk. Over 70% of us, or over the age of 65, will end up needing some level of long-term care risk. For men, the average stay in some type of facility is 2.2 years. Of needing care at least, and for women it's close to double that. It's 3.7 years. And I would say that those are just the averages, right? So sometimes stays are very short, but I have experienced much longer stays, and many of you probably have too, where you can climb into the 5, 6, 10 years of being in a facility, and we know how expensive that can get. So I want to make sure that the averages are fine, and a lot of times we plan for the averages, but understand that a stay could be a lot longer. Today in America, the average cost of an assisted living facility is about $85,000. That's in a semi-private room. And that's not even in a dementia facility, which can be even more expensive, into the figures. So the financial risk is substantial, and it can really mess up a retirement income plan. Today, 80% of care is given by caregivers, which are primarily family members. And what I've also experienced over the years of working with folks on this is that a lot of times, if it's a family member that's giving the care, they have to take time off from work. They get tired. It's exhausting work, as you may imagine, and it can really begin to impact the caregiver fairly quickly in terms of their lifestyle and their quality of life. So you can have a situation where a parent needs some help, their spouse is giving them all the assistance they can, but then the spouse starts to wear down, and that's when you can end up in a facility situation very quickly. So it's really kind of a big deal these days. Alzheimer's, as you may expect, is the #1 cause for long-term care stays. Now, what are some of the solutions we can use to help cover this expense? It's a combination of things, to be quite honest. I've already touched on family giving a lot of the care. In most cases, the family member giving the care is not compensated for the time and the hours that they spend. In many families, it can be one particular sibling out of many siblings that's primarily giving the care. But however, it can save on the cost of care at a professional facility. So family is one potential solution, but it's got some drawbacks. Insurance, which we'll talk about a little bit further in the video, is an option to help offset the cost of this care. Medicare, our insurance at age 65 for health care, has very limited resources for long-term care stays. Medicare is more the 90 to 100 day range, and then they stop paying for that level of higher care. And that's when the Medicaid system will kick in this country, and that's a state-run program in addition to the federal system. They get together and work on that together. It's actually, the Medicaid budget for most states is by far the largest budget item for all of our 50 states. Very expensive with the boomers coming through. Another potential solution is to take out a reverse mortgage on your home. So if we have a situation where there's a lot of equity in the current home, we reverse mortgage some of that equity out to help pay for that care. That's not an ideal situation, but it has been done. If you're a veteran, the Veterans Administration definitely has some benefits, and there's different levels to qualify for those benefits. So that's another potential source if you're a veteran. I would say that most of our communities, literally down to the county level, have a lot of great programs out there to help out and give ideas for how to take care of loved ones. The Administration on Aging, the AOA, is a big government agency that provides a lot of different resources to help kind of manage this situation. As I said, most cases end up being a combination of strategy to help take care of loved ones. But the good thing is that we've spent a lot of money in states, local governments, to help support the community in that area. So there's a lot of programs. I'd encourage you to check those out if you get into this particular situation. Lastly, I did mention insurance as a solution. We've probably discussed this with many of you already, but I'll bring it up once again. In the old days, you would purchase a long-term care policy. You had an annual premium. You may pay that premium for 20, 25, 30 years. If you needed the care, you got the level of coverage you had purchased. But many times people would pass away and never needed any long-term care, and then they'd spent maybe $100,000 or more on a policy they never used. And so A lot of folks didn't like that idea, so the insurance industry made an adjustment. And now the most common strategy, I'm not going to get into the weeds, the most common strategy is to have actually a life insurance contract that has a long-term care rider attached to it. If you need long-term care, the policy is there for that. But if you're in that situation where you never need the long-term care and you just pass away, the money that you put into the policy actually will come back to your beneficiaries at your passing. So we look at it more as an asset that's not going to go away, and that's been pretty appealing for folks. So we can certainly talk about that. The real key is staying healthy, exercising, diet. I'm not here to preach to you, but those are the things that kind of help reduce our chances of needing a long-term care stay. So with that brief overview, if you would like to discuss this further with any of us here at the YellowWood team, we would love to help out and help you plan for potential cases. I would say that starting earlier in planning is better. When you start earlier, especially if we do an insurance policy, it's less expensive over time if you start earlier. And then it also eliminates the case of getting some other disease or something that might prevent you from actually qualifying for a policy. So we do like to have these conversations earlier rather than later. Appreciate your attention, and we'll look forward to seeing you next month. Thanks.